WVLK, and it's time for our visit with Dr. K, Dr. Kevin Kavanagh. He's a retired physician and also the founder and president of a national organization called Health Watch USA. And how are you this morning, Doc?
Very good, Jack. Very good.
Good. Okay. What's the news? I know the pandemic backlash is jeopardizing public health powers and leaders. Fill us in on all that.
Well, that's one of the main things, is that the public is really, in many areas, lashing out against public health leaders. According to some reports, and this is an AP News report, 181 state and local public health leaders have either retired, they've resigned, or they've been fired during this pandemic. And this is for what many feel is just doing their job. In other words, they're not being believed by the public. In Kentucky, we've had also a real crisis in public health. We've dropped our workers, this is all workers, not just leaders, by about 50% in our public health departments. And this is not good. And of course, this is due to a variety of reasons. There's the pandemic, there's the retirement. You could take your pick, but nevertheless, we are not supporting public health. And during this crisis, they're expected to step up. They're expected to put their lives on the line. Even just giving out vaccinations has to be one of the most dangerous jobs in America right now. So we really do need to put down our biases. We need to at least support these leaders that are risking their lives. And I can tell you, Jack, many of the friends that I know that work in the medical profession really get hurt and very perturbed that the same people that are calling them either cowards or just following along with a narrative or liars are the same people now which are coming down with the coronavirus. And these healthcare leaders are having to risk their lives treating the same individuals that were calling this pandemic a hoax. So let's really treat them as the heroes that they are. That's just not words. That's something that they're actually doing that is heroic and something that they should be held at the highest level of our society rather than derided and really forced into a situation where they're fearful for their lives.
All right, now I understand New Zealand has lifted all their COVID restrictions, declaring that the nation is virus-free. How'd they get there?
Well, that's correct. They basically followed public health advice. Australia is in a very much similar situation. In Australia, and I think also New Zealand, the populace bought into government advice. Their rates were never severely high. They were relatively low. They were able to handle this with case tracking and close downs. I do not believe that in Australia a major strategy was wearing masks, although in some areas where they had large outbreaks, that was mandated. But right now, those countries are open as we are in the midst of a huge pandemic spike. And so we really do need to follow public health advice and keep safe. And that means social distancing plus wearing masks. Remember the snow leopard, good at enforcing social distancing, not so good at wearing masks. They got COVID. So you have to do both.
And Governor DeSantis down in Florida is suggesting one dose of the Pfizer vaccine may be enough. Where do you get that information?
I think off of some op-ed or blog, in other words, not very reliable news, and it is not enough. It may provide you with some short-term protection. In other words, within that first few weeks, maybe that will give you a 50% protection, but it's not nearly enough, and it's not enough to last just a few weeks. You need to get the full dosage so you have better protection than if you had the infection, and you've got the best chances of having lasting immunity.
And finally, Dr. Fauci is calling the vaccine rollout bittersweet because he says we still have a struggle ahead. He believes that 75% to 80% of the U.S. population would have to get the vaccine in order to achieve herd immunity against the novel coronavirus, and that's pretty high. I hope we can get there.
Well, I do too, and it is high, but we've said this all along that you would need close to 75 to 80% of the people being immune in order to achieve herd immunity. Luckily, this vaccine gives a 95% efficacy rate, and thus 75 to 80% might be achievable if we had the public buying into the pandemic. And believe me, if you are a frontline worker and you're in a situation where it's not if, but when you get the virus, in my opinion, the vaccine is the way to go. If you are very low risk, you'll have some time to sit out, probably a couple of months before you can get the vaccine. And by that time, there'll be much more data available. But everybody needs to realize that there have been massive amounts of people that have already taken these vaccines, 30,000 or so in each of the two experimental groups. And I really do feel that this vaccine is safe as you can get one in the middle of a pandemic. And I'm telling you, Jack, it is extremely important to get this vaccine. Most of the problems of a vaccine occur within the first 2 months of the vaccine administration, and we have already passed that.
Dr. Kevin Kavanagh, thank you so much.
Thank you, sir.